Next is about arocaka pratishedham adhyayam vyakhyaswamyah yathavata bhagavandhanandrihi. Arocaka is dyspepsia, and of course it's related to the conditions like vishuchika and of course vishuchika itself, where ajirna is mentioned. The doshaihi prasak sah chitta viparyacha bhaktayaneshu hridi cha avatate pragadham na अन्य रुचिः भवति तम भिषजो विकारम भक्तोपघातम इह पंचविधम वदन्ति. The bhaktopagata or the dyspepsia or maybe the anorexia, the type a condition where the patient may not like to have the food, can be produced due to the tridoshas, vata pitta kapha, or chitta viparyacha due to psychological stress as such. Because the food, the source of maybe the centers which control the regulation of the food, bhakta ayanas, are the centers which control the consumption of the food. They tend to be affected by the doshas, and hence anya ruchihi na bhavati. The patient would not like the taste of the food. Such condition is a bhaktopagata, and these are 5 times. The 5 types as such. Hritshulana pidanividam virasananatvam makatmike bhavati lingam arochaketo. When it is due to vataja vyadhim, it produces pain, hritshula, pain in the chest, and this anorexia, rather dislike for the food as such, are not appreciating the taste, is vataja. Whereas burning sensation, hriddaha, chosha, bahuta, mukhatiktada, murcha, sadrad bhavati pittagriyatadeva. In pittaja dyspepsia conditions, there will be burning sensation, or even the patient may have a bitter taste in the mouth. There could be even impaired consciousness, excess of thirst. Sarvatmake pavana pitta kapha bahuni rupani yathasya hridaya samudirayanti. In the tridosha vyadhi, you will have all the 3 symptoms like the vata pitta kapha lakshanas are produced. Samraga shoka bhaya vipluta chetasastu chintakrito bhavati sa ashuchi darshanatcha. The ashuchi darshanat, that's due to seeing some disliked substances around, or due to the environmental factors, or due to chinta, the worry, the patient may not like the food. In such conditions, there will be visible depression-like symptoms. Now, a dyspepsia as such now are categorized as organic dyspepsia and functional dyspepsia. Organic dyspepsia, where you will have other underlying diseases like peptic ulcers or malignancy and so on, multiple disease conditions can produce the dyspepsia. There is another is a functional dyspepsia. Functional dyspepsia is now categorized into 2 categories: postprandial distress, where the patient would have a fullness in the abdomen after the food, and epigastric pain syndrome, where the patient would have pain in the chest and burning sensation. I think we have discussed about this issue somewhat in detail when we have discussed about the vishuchika in the previous chapter, and that further classification and approach to the treatment in relation to the Vishabdha Jirna, Vidagdha Jirna and Vishuchika Alasaka. In that condition we have referred to that, so I will not go into the repetition of the same detail. The same issue has to be relevant. Now the treatment in these conditions are Vate, Vachambomanam, Kritaban Pibetcha, Snehi, Surabhi, Athava, Ushna Jalena Churnam, Krishna, Vidanga, Yava, Bhasma, Harenu, Bhargi, Rasna, Yela, Hingu, Lavanottamanagaranam. The Vataja variety of dyspepsia can be treated with the Vamana which could be induced with the Vacha Kvata, and after that the patient has to consume Sneha Dravyas or warm water or alcoholic preparations, and then which could be prepared with the Krishna Vidanga Eva etc. Pitte Gudambu Madhuri Vamanam Prashastam Sneha Sasaindhava Sita Madhusatpirishtaha. In Pittaja variety, the Vamana has to be induced with the Gudambu, the shat, where you mix Guda with the water, and then that has to be given for the Vamana, and then the Sneha preparations with the Saindhava Madhu etc. Nimbambu Amitavada Kapaja Anupanam Rajadhumam Madhuna Sadipikam Theatre. In Kapaja variety, Vamana has to be done with the Nimbakwatha, and then the Anupana has to be given with the Madhu, Deepika etc. Churnam eduktam anilajayatadeva. In all other conditions, the same Vataja variety or Vataja Ajirna treatment protocol have to be followed in other conditions. Sarveshcha sarvakritameva upakarmeta. Tridosha variety, all these protocols can be used. Satmyan Swadesha Rajitan Vidhashta Bhakshan Panani Mula Pala Chadava Raga Yogan Adyad Rasamscha Vividhan Vividehi Prakarehi Bunjita Chapila Laghu Rukshamanas Sukhani. The general protocol in all the conditions of dyslexia would be you have to give some food which is liked by the person and which is prepared in the same geographical zone. Each food, Swadesha Rachita, are something which is prepared in the form which is acceptable to the patient, and such food substances could be like Mula Phala Chadava, any sort of preparations of the food could be given to the person in a pleasant environment. Then Asthapanam Vidivadatra Virechanam Kuryat Muduni Shirsasta Virechanani. The other options could be Asthapana, Virechana, and Shirovasti, Shiro Virechana also can be given. Trini Ushanani Rajani Trifalayutani, Churni Kurtani, Avashuka Vimishritani, Shaudra Yutani Vitare Mukhabodhanartam, Sag Esha Eva Kapavata Hate Vishishta, Shantim Gate Huta Bhuji Prashamaya Tasya, Trikatu, and Rajani Haritra Trifala, etc. With the Churna, they have to be given with the Shaudra for making the person able to appreciate the taste. Mukhabodhana is ability to appreciate the taste. The same also can be given in Kapavataja Vyadhi, in Agni Mandya also the similar treatment can be given. Ichha Vighata Bayashoka Hate Antaragno Bhavan Bhavaya Viparet Khalu Shakya Rupan Artheshu Jabi Apachiteshu Punar Bhavaya Pauraniki Shruti Shakri Anumanayattam Dainyam Gate Mansi Bodhanamatra Shastram Yajyapriyam Tadupasevyam Arochaketu. In the patients who have psychological disturbances produced due to either inability to act, get whatever you have liked, like Ichha Vighata is when you are not able to get whatever you have liked, or due to fear or depression. In such conditions there could be Agnimandya. In such conditions of Agnimandya, the treatment has to be given with the suggestions, counseling, Pauranike Shrutishatehi, with all the Pauranika stories which can make the person stimulated. Such counseling has to be done, and other food substances which could be liked by the person should be given. That's about one of the chapters, the shortest of the chapter. It is Sushruta Samhita Mutraghata Kachikisa Tantre Arocaka Pratishedho Nama Ekonavimshodhyaya Hatitah Saptapanchashattama Adhyayah. Then the next part we will discuss about the next chapter, 58th chapter, that is a mutraghata pratishedham adhyayam vyakhyasyaamaha. The athata mutraghata pratishedham adhyayam vyakhyasyaamaha ithovacha bhuvandanantarihi. Mutra abhigata or mutraghata are those conditions where there would be abnormality of secretion of the urine. See, the diseases of the urinary tract, they are categorized into two categories: prameha, mutraghata, and mutrakritsha. The prameha is that condition where there is an abnormality of the formation of the urine, as we discuss in the contemporary situation as nephrological conditions. Then the other part is about the excretion of the urine, mechanisms of the excretion of the urine are aerodynamic abnormalities. They are the mutraghata. And then of course the mutrakritsha is those conditions where there would be severe difficulty in the maturation activity, which could be due to some abnormality related to the content of the urine. Now, among the mutraghata mentioned by Sushruta, they are 12 varieties, and they are Vata Kundalika, Asthila, Vatabasti Strarevaja, Mutratitaha, Sajataraha, Mutrotsangaha, Kshayasrada, Mutragrandhi, Mutrashukram, Ustamataha, Tataivacha, Mutrokasado, Dvauchapi, Rogaha, Dvavashikirtidaham. Now, each of these would be the first of these Vata Kundalika. Rokshat, Vega Vighatadva, Vayuhu Antarmashitaha, Mutram Terali Sangrashya, Vigula Kundalikrataha, सृजेत् अल्पाल्पम् अथवा सरुजस्कं शनैः शनैः वातकुण्डलिकान्तं व्याधिं विद्यात् सुधारणम्. In case of Vatakundalika, due to either the dryness of the food consumed as the Ruksha Guna, which is aggravated, or Vegavighata, due to suppression of the urge for micturition, there would be an impairment of the control of the bladder, and that results in or rather abnormal movements of the reflex activity. The reflex activity of micturition become somewhat abnormal, and as a result of that, the person would be excreting small amount of the urine repeatedly. Small amount of urine is excreted with the slow flow as such. Such condition is Vatakundalika. Now, in the current of urological practice, there is one word called as LUTS, or lower urinary tract syndromes, a group of conditions which are called as lower urinary tract syndromes. Among them, the most common, of course, is the prostatic hypertrophy. The other less common conditions, which are quite frequently seen, of course, in the clinical practice, are many, and we will come to all of them in due course of time. One of them would be low detrusor activity. The neurological, it's not an established neurological condition where the exact pointing out of the neurological pathology may not be possible many times, but there is some abnormal contraction of the detrusor muscle, the bladder muscle. That's exactly what's mentioned as Kundalikrita. And due to that low detrusor activity, the contraction time as well as the pressure within would be lesser. As a result of that, the urinary flow would be prolonged, and the bladder emptying or failure to achieve complete bladder emptying within a normal time span measured by urodynamics. Urodynamics is the most important method of differentiating this when the patient has the symptoms of LUTS or symptoms of lower urinary tract syndromes. And this also is called as hypocontractile detrusor, and the hypocontractility is described as reduced strength of the activity, and this is one variety of a neurogenic or non-neurogenic lesion. There may not be a obvious evidence of the neurogenic lesion there. We will see many such patients, usually of older age category, with these kinds of the symptoms. And the better way of making that diagnosis would be, if available, urodynamic study. In a urodynamic study, when you study the urodynamics as such, the bladder pressure, you will have regular waves of contraction when the bladder is full, and when there is a micturition, the micturition flow would be, pressure would be normal. Whereas in the patients with the low detrusor activity, there will be low intensity, very frequent contractions of the bladder, but then there will be a gap. Again, there will be a repeated episodes of that can be confirmed. If you study the uroflowmetry, the flow, now of course urodynamics is often a bit complex method of investigation. Uroflowmetry is a simple method of investigation. Or if you take the history, if you look at the flow of the urine, that can be made out. A normal flow of micturition would be like beginning of micturition, the flow would be increasing, and then it reaches a peak within a short duration, and then it comes down. The pressure of flow would be coming down. Whereas in the patients who have low detrusor activity, the flow of the urine, as you see, as the patient observes, it will be like a few drops, again a few drops, again a few drops, and then the pause. That intermittent flow of the urine, that's exactly what's mentioned by Shanai, the flow as such. That would be the typical clinical symptoms. The clinical typical symptoms will be slow urinary stream, hesitancy and straining to void, and without a feeling, with or without a feeling of incomplete bladder emptying, sometimes with some accumulation of the bladder also. So most of the times this would be one of the important different diagnoses for prostatic hypertrophy. Many times the patients would come with, we make a clinical diagnosis of prostatic hypertrophy, but when you go for the investigations, the prostate size may not be much affected. Such a condition, one of the causes could be the low detrusor underactivity or low detrusor activity. And most of the times it's in the old age, the condition is seen in the old age above 70. And the management from our clinical point of view in the regular practice, but I would use is a Rasayana Chikitsa like maybe Rajayapanabas if necessary, or Chandraprabha and Ashwagandharishta is a usual prescription. Now, the next is about Vata Sthila, or the real conditions of the prostatic hypertrophy. In the Vata Stila, Shakar Nargasya Bastescha, Vayu Antaram Ashida, Asthilavad Ganam Granthim Karoti Achalam Unnatam, Bin Mutra Anila Sangascha, Tatra Adhananti Jayate, Veda Chaparabasto, Vata Stila, Tam Viduhu. A condition where there would be a palpable mass in between the rectum and the bladder. When you do the rectal examination, the mass would be palpable. Now, of course, a palpable mass is described especially in case of Vata Stila as well as mutraghata. The difference is in mutraghata there will be acute pain, whereas in case of Vata Stila, the pain is only a relatively less common symptom or a milder symptom, whereas the obstructive symptoms are more, and the granthi is ghana, firm consistency, immovable swelling. So that description of the prostatic swelling is absolutely the same as we do, though Sushruta has not described in detail about how to do the rectal examination. He has not mentioned like that whether you do the digital examination or not. But the description is quite obvious, and hence it's quite obvious that it is a felt protectory. And the location is also very clearly described, like in between that anal margin, the sacral marga is the anal cavity, and basti in the bladder. In between that the lesion is spread, and it results in obstructive symptoms as such. Definition of benign hyperplasia. Now, prostatic hyperplasia is one of the conditions, and of course now it could be either benign or malignant, but in the current urological practice, it is defined as a histological diagnosis, where it's characterized by stromal and epithelial cell hyperplasia beginning in the periurethral zone of the prostate. Now, so though we make a clinical diagnosis, ultimately the diagnosis has to be made out by the histological evidences. That's what the current guidelines would say. But the other way is, most of the times we make the diagnosis based upon either the weight of the prostate as decided by the ultrasonography. In the ultrasonography, you can calculate the weight of the prostate as well as the volume of the prostate. The average weight of the prostate in a normal condition is considered to be 7 to 16 grams, and volume is considered to be 30 cc. Anything above is considered as an enlarged prostate, and enlarged prostate could be produced due to either benign prostatic hypertrophy, which is most common, or occasionally malignant changes. So this has to be decided by histopathological evidences, or maybe further more investigations, sequence of the investigations required, or the prostatitis, inflammatory pathology. Inflammatory pathology, the condition will be acutely painful, whereas the benign prostatic hypertrophy and malignancies, they are usually painless. So that's how we usually make the clinical diagnosis. The other way, the clinical diagnosis, the diagnostic criteria would be the digital examination and then AUA questionnaire scoring. I will come to that. Questionnaire scoring, this is one of the important issues. Either it's AUA or International Urological International Prostatic Association, IPSS questionnaire, almost same. Then USD findings, where the residual volume of is one of the important issue. When you do the prostatic hypertrophy or ultrasonography, size of the prostate as well as how much of the volume is left over at the end of maturation, end residual volume, is one of the important criteria. Uroflowmetry also is another quite important issue. In a typical uroflowmetry, that's what I have mentioned earlier, a typical normal urinary flow would be reaching a peak and then it gets reduced. Whereas in a prostatic hypertrophy, particularly benign prostatic hypertrophy, the onset is slower, it reaches a lower peak and it takes a longer time. And of course in the urethral stricta, there will be an obstruction, the peak would be very low and the pattern of the urinary flow would be like this third line, and that's how it has to be differentiated. A prostatic hypertrophy and the stricture which can produce obstruction can be differentiated. When I said earlier I said about the scoring, questionnaire scoring, the standard now is to go for this questionnaire scoring, where the question is about feeling of incomplete empty, frequency of maturation, and the then feeling of urgency as such, and whether there is a incontinence or not, leakage of the urine or not, and urgency and weak stream, and the straining, whether the patient requires straining or not. These are the typical questionnaires which are done, and that questionnaires, the scoring is based upon the frequency of such events in the past 1 month, and then you get the score. And then of course another is question asked is a quality of life questionnaire, like whether the patient feels really disturbed with this condition or not. That also is another of the criteria, and by this the prostatic hypertrophy is diagnosed, and the plan for action, like whether you need intervention or not, is based upon this the scoring system, and either it's ADA, that's American Urological Association, or International Prostate Symptom Score, IPSS score is used. Now these days IPSS score is more popular. The even prostatic hypertrophy is graded based upon the histological finding. In the histological findings, if the patient is above 80, 90% are benign. If the same prostatic hypertrophy is seen in less than 50 years of age, then the chances are that it could be malignant. So 25% only are benign, the remaining could be malignant. So usually we guess about the possibility of malignancy or benign based upon the one is the age. Then of course histological is the other issue, and as per the data, a benign prostatic hypertrophy diagnosis is never possible before the age of 30. This is as per the data, but of course there are some questions. This statement is somewhat arguable. Now there are some claims that the benign prostatic changes are seen even the age of less than 30 years, but in general it is a very less frequent. So a prostatic mass or increased size of the prostate in lower age group, the chances of malignancy is higher, whereas in the higher age group the chances of benign pathology is more common as such. The usual guidelines for the treatment would be surgery is recommended only when the patient has a renal insufficiency, that's the renal functions are affected due to the prostatic hypertrophy, or there is a urinary retention which doesn't respond to the usual medical treatment, or the patient who has a recurrent urinary tract infection, a patient who has a recurrent bladder stones or gross hematuria due to prostatic hypertrophy, or that same lower urinary tract symptoms are produced, or the patient who doesn't will to take the medicines. That conditions are the treatment indications for the surgery. Of course, the medical treatment now in the contemporary system, you have many of the alpha blockers which are used as a treatment for the prostatic hypertrophy. From our point of view, Chandraprabha Mustraghata is one of the better options for the treatment of prostatic hypertrophy. Then the other is mutraghata. Vegam vidharadyasto mutrasya akushalo naraha nirunakti mukham tasya bastehe bastigato anilaha mutrasango bhavettena basti kukshinipidaha vastabasti sajnyaha vyadhi kritra prasadanaha. Vatabasti is another of the condition where the patient would be suppressing the urge for micturition, resulting in a obstruction in the basti mukha, bladder neck obstruction would occur, and hence the patient would have a retention of the urine, and that's exactly what we call as the bladder neck obstruction condition. Then vegam sandharya mutrasya yo bhuyah srastum ichchati tasya naphyeti yadi va katanchit sampravartale prabahato mandarujam alpam alpam punah punah mutratidam tam vidyata mutra vega vighatajam. Another of the condition where the patient would be suppressing the urge for micturition, but when he attempts for the excretion again, he is not able to allow the mutra the urine to flow out, and when a patient strains more, there could be a painful and small quantities of the urine secreted. That's considered as a mutraghata, which is produced due to mutraghata. This is exactly the detrusor overactivity, and the detrusor overactivity just the opposite of the vata kundalika. There would be a impact. Most of the times it could be due to some local obstruction of the detrusor muscle, where the bladder would be overactive. Very often it's produced due to some compression of the bladder due to either injury or fecal impaction as the most common condition, and it is defined as detrusor overactivity is defined as a urodynamic observation characterized by involuntary detrusor contractions during the filling phase that may be spontaneous or provoked, and detrusor overactivity is subdivided into idiopathic or neurogenic detrusor activity. The patient clinical symptoms will be feels a sudden urge to urinate that's difficult to control. The patient would not have a urge for defecation, urge for maturation, and he is not able to control it. And that there could be an urge incontinence, there could be leakage of urine due to involuntary flow, and the frequency of urine is increased, urinates frequently, usually 8 or more times within 24 hours, and awakens 2 or more times in the night to urinate. That are the typical symptoms. And the other conditions which should be ruled out would be diabetes, drug addictions as such. Urodynamic study would confirm detrusor overactivity, where you will have repeated slow waves which are presented over there, and the patient would have the clinical symptoms exactly. The treatment I would prefer would be Smithsagara, Chandraprabha, Sahasrarishta or Kamadhuga and Vishirasa, depending upon the symptoms. Then the other condition is the mutraghata nirodhacha, that is the bladder neck dysfunction is a मूत्रस्य विहते वेगे तद् उदावर्तहेतुना अपानकुपितो वायुः उदरं पूरयेत् भृशं नाभेः अधस्ताकात्मानं जनयेत् तीव्रवेदनं तं मूत्रजठरं विद्यात् अधस्रोतो निरोधनम्. Another of these, the vatabasti as well as the conditions of the mutrajatara, they have very similar clinical symptoms, and I consider both of them as bladder neck dysfunctions. Again, the typical history is the patient would suppress the urge for maturation, and that results in a tendency for retention of the urine with a bladder which is filled, and there would be adhasroto nirodhanam, an obstruction in the lower part as such. Now, the bladder neck dysfunction is the condition which can be considered as mutra jatara or even the mutra samshaya. The typical history would be most common clinical symptoms of bladder neck dysfunction is the nocturnal enuresis, where the patient would have an involuntary this excretion of urine at night, particularly in children. And the other symptoms would be there could be slow flow, postvital residual volume increases with the chronic retention. There would not be any pain there because of the chronic retention as such. The management would be in such conditions, if the end residual volume of urine is more than 200 ml, intervention is required. Intervention like surgical intervention would be required. The confirmation of the diagnosis is done by either cystoscopy or by the urodynamic study. In the cystoscopy or the even X-rays, the cystogram, the bladder seems to be distended and neck is not widened. That neck being narrow is the typical sign over there. Urodynamic studies also confirm the same, like there would be a low pressure activity in the bladder as such. And the treatment would be either it could be Ekangvira, Ashwagandharishta, Niruhabasti is the usual preferred treatment in such conditions. Then comes the Mutra Utsanga. Mutra Utsanga is Basta Vapi Athava Nale Manavaya Silehinaha Mutram Pravrutam Sajjeta Saraktam Va Pravahataha Sarver Shanehi Alpamalpam Sarujam Va Atha Nirujam Vipuna Anirujo Vyadhi Samutrotsanga Samnidha. Mutrotsanga is a typical condition that there would be an obstruction as such in the urethra, and the causes could be it results in a flow of the urine which is obstructed, and there could be even bleeding occasionally. The patient has to strain more, and when he strains more, there will be small quantity of the urine secreted out. That's the stricture could be produced due to many conditions, and it's also a common disease in men with the evident maybe incidences are 229 to 627 per 1 lakh males, or 0.6% of the risk population who are typically older men. The stricture is categorized as idiopathic and trauma or iatrogenic or lower lichen sclerosis, patients with the lichen conditions. And the location could be, usually it's in the bulbar urethra. Majority of the conditions of idiopathic, they would be in the bulbar urethra, particularly those who get infected as such. confirmation of the diagnosis by uroflowmetry or urethrogram X-rays will show that evidences. And the treatment ideally would be dilatation of the urethra, or at times it could be urethral stricture could have be treated with the visual urethrotomy or self-catheterization or urethroplasty as such. That's about the treatment as such. Even Sushruta has mentioned about the similar form of the dilatation treatment in the context of Niruddha Prakasha. The dilatation protocol is described exactly as we do it now. The only difference is about the frequency of doing that protocol. In Sushruta, the discussion or description is in the context of Niruddha Prakasha, not in the context of Mutraghata that is mentioned. But anyway, that protocol can be followed as such. Then comes the Mutra Samshaya, which also is a variety of detrusor overactivity, which we have discussed in the earlier context. Rukshasya klantadehasya bastistau pittamarthau sadah vedam krisham kuryatta mutra samshayam. The kapha, pitta and the vata located with producing burning sensation and difficulty in the micturition, which I would consider as the same as a detrusor overactivity. Then the other is a mutragranthi, which I just referred to earlier, a condition where there could be a palpable mass in the neck near the neck of the bladder, but it would be painful. Abhyantare basim ke vritto alpaha sthira eva cha vedanavan ati sada mutramarga nirodhanah jayate sahasa yasya granthi ashmani lakshanah sam mutragranthi ityevam uchyate vedanadibhi. Mutragranthi is a palpable mass in the lower end of the bladder, and which produces an obstruction which is having a rapid course, jayate sahasa, rapid course, and there could be acute painful condition. That's typically in the case of prostatitis or bladder tumors. Prostatitis is more common. Whenever urinary symptoms do occur in a younger age, usually the prostatitis could be the cause. And the prostatitis again categorized as acute bacterial prostatitis, where there would be acute inflammation, patient would have high toxic symptoms. Chronic prostatitis would be there will be chronic inflammation, which also can result in a stricture, narrowing in due course. Then chronic with the pelvic pain syndrome is another category, where the patient would have pain in the pelvic area, and the patient would also have micturition along with the flow of semen and micturition may be seen as such. And then there is a asymptomatic prostatitis, another condition where the patient may have the increased cell count in the urine, as well as the semen may be present over there. The usual clinical symptoms would be painful micturition or blood in the urine, groin pain or rectal pain or abdominal pain, that's the pain which is present in the pelvic area as a whole, fever and chills, body aches, urethral discharge, painful ejaculation or sexual dysfunction could be the usual symptoms of prostatitis. Usual main treatment would be Chandrapura, Chandrakarasana, Chandrasava in acute prostatitis conditions. Then comes urethritis. Urethritis is mentioned by Sushruta as Pratipasthita mutrastu maithunam yo abhinandati tasya mutraidam devah sahasa sampravartale purastradvapi mutrasya paschadvapi kadatana bhasmodaka pratikasham mutra shukram taduchyate. Mutra shukra is a situation where patient would have a sexual activity and followed by sexual activity, and according to Sushruta, the reason for mutra shukra is a sexual activity when you have an urge for micturition, but whether it's exactly the same or not is a question mark. And at the end of that, the person would be excreting a turbid flow of urine, bhasmodaka pratikasha. A turbid urine is flown or secreted either at the beginning or at the end of the micturition. This, of course, is very commonly seen either due to the presence of seminal discharges in the urethra, or very commonly the other way in case of venereal disorders like gonococcal conditions. Gonococcal or urethritis produced due to venereal condition. This is a very common phenomena. Or even non-venereal urethritis also can present with the similar symptoms as such. Then the other conditions, last of the condition is Ushtamata. In the Ushtamata, व्यायाम अध्वातपैः पित्तं बस्तिं प्राप्य अनिलावृतं बस्तिं मेढ्रं बुधं चैव प्रदहन् सावयलदः मूत्रं हारिद्रम् अथवा सरक्तं रक्तमेव वा कृच्छ्रात् प्रवर्तते जन्तोः उष्णवातं तदनुचितम्. Due to exposure to heat or during this exercise, when there is involvement of basti and this pitta and vata in the basti, which produces a burning sensation, and the urine could be dark colored, yellowish colored, or there could be hematuria also, or blood stained urine could be presented. Such condition is Ushnavata. Now, this is typically seen in case of urinary tract infections with the aciduria, or a concentrated urine in summer. This is a common phenomenon. Another of the condition is the mutraghata. Mutraghata again is two categories, either pittaja or kaphaja. Now the features would be विशदं पीतकं मूत्रं सदाहं बहलं तथा शुष्कं भवति यच्चापि रोचनाचूर्णसनिभं मूत्रोपसादं तं विद्यात् रोगं पित्तकृतं बुधः पिच्छिलं संहतं श्वेतं तथा कृच्छ्रपवर्तनं शुष्कं भवति यच्चापि शङ्खचूर्णप्रपाण्डुरं मूत्रोपसादं तं विद्यात् आमयं द्वादशं कपात्. The mutraghata is the presence of some crystalline substances in the urine, and depending upon the color and presentation of the symptoms, like if it is a amorphous substance and yellowish colored, there could be burning sensation. The substance is something like gorochana, yellowish or greenish colored substance, then it is a pittaja mutraghata. When the similar substances present in the urine would be somewhat compact and whitish in color, and they resembles that of Shankachurna, like white, maybe lime-like appearances, then it is considered as a kaphaja. Now these can be seen in many metabolic disorders. Patients who have any metabolic disorder like oxaluria or the phenylketonuria, in such conditions these crystalline substances could be seen in the urine in many times. But the most commonly seen is a phosphaturia, particularly in bedridden and catheterized patients, as a combination of infective pathology as well as the bone mobilization, calcium mobilization and phosphate mobilization from the bones result in these conditions, and I would consider them as mutraghata, either kaphaja or pittaja. Now, in the current urological practice, all the clinical conditions which are presented with the urinary obstructive symptoms, which are categorized as LUTS or lower urinary tract syndromes, which could involve nocturnal polyuria, overactive bladder, or detrusor underactivity, or benign prostatic hypertrophy, then the distal ureteric stone as such, bladder tumors, urethral strictures, foreign body, urinary tract infections, and so on, and neurogenic bladder dysfunctions, and chronic pain syndrome, pelvic pain syndromes are categorized as LATS. The same can be seen from Sushruta's point of view as the mutraghata, the vata kundalika, detrusor underactivity, then the mutra stela, benign prostatic hypertrophy, vata basti in overactive bladder conditions, then mutraghata in case of neurogenic bladder dysfunctions and bladder neck dysfunctions, mutraghata also in the same category, then mutrotsanga in urethral stricture conditions, and mutra samshaya in chronic pain, pelvic pain syndromes. Mutra granthi is either bladder tumors or prostatitis like conditions, then ushnavata in urinary tract infection conditions. Mutra shukra also is maybe the urethritis like conditions which would be categorized. Mutraghata maybe it may be categorized as the others, like where there would be metabolic pathology, and pittaja and kaphaja are the two varieties of them. That's how we can make out. So exactly whatever is the current urological practice or discipline for this categorizing them, the same is described in Sushruta as such. Now coming to the principles of the treatment mentioned in Sushruta, in general, in all cases of mutraghata, the treatment protocol would be kashaya kalkasattvamshi bhakshan lehan payansi ja kshara madhu madhya asavasvedan bastinscha uttarasamjidan viradhyat matimastra vidhim cha ashmari nashanam. All the ashmari protocol can be used, and then kashaya kalka sarpi leha kshara madhya, any different presentations can be used, or mutra udavarta yogascha kasne natra prayageta. All the Udavarta yogas also can be used in the treatment. Kalkam Yervar Bijanam Akshamatram Sasaindhom Dhanyam Liktam Pitpavya Mutraghata Pramuchyate. Yervar Bija Kalka Vidut Saindavalavana Vidut Dhanyamla. Then Suram Savarchalapatim Mutraghati Pibenaraha Madhu Mamsopadam Shubha Pibeda Piata Godikam. Alcoholic preparations with Suvarchala Lavana or with the mamsa has to be consumed. Alcoholic preparations are suggested as one of the options of the treatment of mutraghata. Pibet kunkuma karsham cha madhudaka samayikam ratri parisham pratah tata sukam apniyat. Kunkuma also can be given. Darimamlam yutam mukhyam ela dhirakaragarehi pitva suram salavana mutraghata pramachare. Another of the yoga, Sura Yoga. Prazak Parnyat Vargasya Mulam Bukshurukasya ja Ardhaprasthena Toyasya Pachet Kshirachaturgadam Kshiravasishtam Tatshitam Siddhakshodraitam Vibeta Naro Martha Pittota Mutraghata Nivaranam in Vata Pittaja Mutraghata conditions Prazak Parnyadi Gada Dravya with Kshirapaka has to be given. Nishpidya Vasasa Samek Varcho Rasabhavaji Noho Rasasya Kodavam Tasya Pibet Mutrarujapaham. The fecal extract, fecal juice of donkeys and horses also can be given for reducing the pain in the urine. Musta Abhaya Devadaru Murvana Madhukasita Pibe Rakshasam Kalkam Sudosha Nivaranam. Now this is exactly the drug which is available, or the combination which is available in our hospital as a Mustadi Kalpa, which is quite frequently used in our regular practice. Musta, Abhaya, Devadaru, Murva and Madhuka. These are the drugs which are given in the form of Kalka according to Sushra, but what we give is in the form of Churna. Abhaya Malaka Akshanam Kalkam Balasamidam Abhasa Alavanopetam Pibet Mutrajapaham, another of the yoga. Udumbara Samam Kalkam Drakshaya Darsayutam Pibet Varisham Ratro Shitam Mutrajapaham. Draksha Kalka is to be the other suggested option. Nidiktikaya has Sarasam Pibet Kodavasamitam Mutradosharam Kalyam Athava Kshaudra Sayutam Prapidya Amalakanam to Rasam Kodavasamitam Pitva Agadi Bhavetchantu Mutradosha Jataraha Dhatri Palarasena Sukshmelama Pibenaraha. The other options of the treatment of Mutraghata, the different juices of different plants like Pishtva Athava Sushitena Shali Tandulavarina Talasya Tarunam Mulam Prabhusasya Rasam Tata Shvetam Karkatam Jeva Pratastu Payasa Pibeta Shali Tandulavari, the water used for washing the rice, and it's used, and even the folklore practice is one of the very commonly used preparation in the folklore practice. Shrutam Madhurehi Kshiram Sarpit Mishram Pibendraha Mutradoshi Vishuddhyartam Tadeva Ashmari Nashanam. The other Kashayas with them Madhura Dravya. Bala Ashwadamstra Krauncha Sthi Kokilaksha Pandulana Shataparvaka Mulam Devadar Sachitrakam Akshabijam Suraya Kalki Kritya Pibenaraha Mutradoshi Vishuddhyartam Tadeva Ashmari Nashanam Patalaksharam Ahritya Saptakritva Parisrutam Piben Mutra Vikaranam Samsystem Taila Matraya Kshara Yogas and Taila Yogas. Nala Ashma Bheda Darbha Ikshu Trapusa Yervar Bijakan Kshire Parishradan Tatra Pibet Sarpi Samayitana, another of the yoga. All Mutra Dravyas are used. Patalyaha Yavashukacha Paribhadra Tiladapi Ksharodake Namatiman Pagela Ushana Churnagam Pibet Gudena Vishrama Lishat Lehan Tatak Pradaka. Either the Leha preparation of with these drugs could be used. Ata Urdham Prokshami Mutra Doshe Kramam Hidam Sneha Svedopannanam Hidam Teshu Virechanam Tata Samshuddha Dehanam Hidashta Uttaravastayaha. In general, in Mutra Dosha, initially Snehana and Svedana, then Virechana has to be done, then Uttaravasti is suggested. Striyana Matiprasangena Shonitam Yasya Drishyate Maithana Uparamastasya Brahmanasya Vidhi Smraha. If there is a hematuria-like condition due to overindulgence in the sexual activity, that sexual activity has to be stopped and Brahmana Vyasa have to be given. Tamrachuta Vasa Tailam Hitam Te Uttarabastishu Vidhanam Tasya Purum Hi Vyasata Pariketiram. The Vasa of cock's chicken is in the form of Taila, is given in the Uttarabasti. I don't know whether it's really useful or not. No practical experience about that. Vidhanam tasya purvim vyasada parikirtam. The protocol of this is mentioned in the earlier chapters. क्षौद्र अर्धपात्रं दत्वा च पात्रं क्षीरसर्पिषा शर्करायश्चूर्णं द्राक्षाचूर्णं च तत्समं स्वयं गुप्ता फलं तैव तथैव इक्षुरकस्य च पिप्पलिचूर्णसंयुक्तम् अर्धभागं प्रकल्पयेत् तदा एकभ्यं समानीय खजेन प्रमन्थयेत् ततः पाणितरं चूर्णं दीर्घा क्षीरं ततः पिबेत् एतत् सर्पिः प्रयुञ्जानः शुद्धदेहो नरस्सदा मूत्रदोषान् जयेत् सर्वान् अन्ययोगैः सुदुर्जयान् जयेत् शोणितदोषांश्च वन्द्या गर्भं लभेत च नारी च एतत् प्रयुञ्जाना योनिदोषात् प्रमुच्यते. Another of a broad spectrum yoga where it's given in the form of a leha. Then bala kolastimmadukam shodamshra atha shadavali मृणालं च कशेरुश्च बीजान् ईक्षुरकस्य च सहस्रवीर्याम् अंशुमती पयस्या सहकारया शृगालभिन्ना अतिबल ब्रह्मणीयो गणस्तुला एतानि समभागानि मतिमान् सह साधयेत् चतुर्गुणेन पयसा गुडस्य तुलया सह द्रोणावशिष्टं तत्पूतं पचेत्तेन घृताटकं तत्सिद्धं कलशे स्थाप्यं क्षुद्रप्रस्थेन संयुतं सर्पिः एतत् प्रयुञ्जानं मूत्रदोषात् विमुच्यते. तुगाक्षीर्याश्च चूर्णानि शर्करायाः तथैव च क्षौद्रेण तुल्यानि आलोड्य प्रशस्ते अहनिलेहेत् तस्य खादेत् यथाशक्ति मात्रां क्षीरं ततः पिबेत्. शुक्रदोषान् जयेत् मर्त्यः प्राश्य सम्यक् सुयन्त्रितः व्यपाय क्षीणरेतास्तु सद्यस्थं लभते सुखम् ओजस्वी बलवान् मर्त्यः पिबन्नेव च हृष्यति. Another of the शुक्रदोषहर योगा. चित्रकस्सारिवा चैव बला कालान्सारिवा द्राक्षा विशाला पिप्पल्यः तथा चित्रफला भवेत् तथैव मधुकं पथ्यां दद्याद् आमलकानि च घृताडकं पचेदैभिः कल्कैः कषसमन्वितैः क्षीरद्रोणे जलद्रोणे तत्सिद्धम् अवतारयेत्. शीतं परिश्रुतं चैव शर्करा प्रस्थसंयुतं दुर्गाक्षीर्याश्च तत्सर्वं मतिमान् परिमिश्रयेत्. ततो मितं पिबेत्काले यथा दोषं यथा बलं वातरेताः श्लेष्मरेताः पित्तरेतास्तु यो भवेत् रक्तरेताः ग्रन्थिरेताः पिबेत् इच्छन् अरोगतां जीवनीयं च वृष्यं च सर्पिः एतद् बलावहं प्रज्ञाहितं च धन्यं च सर्वरोगाभं शिवं सर्पिः एतत् प्रयुञ्जान स्त्रीगर्भं लभते अचिरात् असृग्दोषान् जयेच्चापि योनिदोषांश्च संहतान्. Another of a broad spectrum yoga. With this we conclude the chapter. इति सुश्रुतसंहिता मित्रतन्त्रान्तर्गते काचिकित्सातन्त्रे मुत्राघात प्रतिषेध नाम विंशोऽध्यायः. If there are any questions, I will try to answer and then we will wind up. Right, there are no questions, so we will